is Varsha Sharad. I'm a speech language pathologist at Lorem. Today we're going to discuss something related to role of speech language pathologist or speech therapist in stroke rehabilitation. Often stroke is termed as something where you lose your abilities, be it in your cognition or your physical abilities or speech abilities. But in simple words, stroke can be termed as something that happens when your nerve supply or your blood supply to the brain is being cut off. Stroke and traumatic brain injury causes the death of nerve cells in your brain, and it often results to your quality of life being at stake. So what are the professionals that are involved here? Are mostly physiotherapist, neurologist, psychologist and a speech therapist. But imagine suddenly a particular day you wake up and you realize that you can't speak again, or there's no communication, or you're not able to eat as you previously were able to. That's when we come in. So what we do is we assess the overall ability, be it speech, language, communication or their swallowing ability, that is pre and post. So what we see is the condition, and then we see what happens after their stroke, what has happened, how has it depleted. All these are profiled and further intervention is tailored according to the need of the individual. So there are three domains that are specifically affected following stroke. The first is the speech, second is their language, and third is swallowing. In speech, if you see, we see a lot of people when they come to us, they have issues in clarity. It's called slurring of speech, where we are not able to understand what the person wants to communicate because certain words don't sound similar to how they actually should sound. Second is when the rate of speech is affected. It can be very slow, or their fast rate of speech where they miss out on some words. The third thing is when their voice is changed, that is there's some tremor to the voice, or that's breathiness, it's very hoarse in nature, or they're not able to speak loudly. There are various conditions. So we provide with appropriate articulation therapy and also voice therapy in order to get back to their original or how they were previously to stroke. And one more thing is when we come to language disorders, mostly what we see is people with stroke cannot understand what we are saying. They may not be able to comprehend what we are intending to say. They may know what they want to say but are not able to express themselves. We can see a lot of word finding difficulties. They use a lot of fillers. They go around what they want to say. If they want to say pen, but they instead end up saying something that we use for writing. Sometimes it happens, they have word finding difficulties. We can also see few individuals having reading and writing difficulties. All of these cases we help them communicate better using an alternate mode of communication. If they are not able to speak better, then we use writing as a modality. If they are not able to write, we give them practices which involves reading and writing too. The third is swallowing, where they were able to swallow before, now they are not able to swallow independently. They are in need of a nasogastric tube or a support system. Now what happens here is we train them step by step, where we are transitioning them from liquids to solids using intervention which is intensive in nature. So the end goal is to make them independent so that they can eat by themselves. So apart from all of these three, we also ensure that we integrate them into the community. So unlike in other condition, in stroke if you see, it's pretty traumatic because the changes happen very suddenly and abruptly. And all of these add on to their mental trauma. So as a part of the rehabilitation team, we are supposed to involve the family too. So we're supposed to explain to them what exactly is stroke, why are they having this problem, and we can make them more accommodating to the particular situation, and also we can give them an understanding of how we have to expect from them. We cannot have high expectations that the patient is going to speak or eat normally in few days, but give them better expectations that can happen through the course of treatment. And in overall, the entire rehabilitation process for a patient with stroke, following stroke or the family can be very exhausting and draining. So what we need to have is a very sensitive and a comprehensive treatment plan. So as a family, what you need to do is to approach a professional who has a comprehensive rehabilitation plan in hand, so that their therapeutic process, rehabilitation and stay, all of this goes smoothly and the patient has a better quality of life. The entire rehabilitation process for a patient or the family can be very exhausting and draining. So it's up to the professionals like us to be more sensitive and make it a more comprehensive rehabilitation plan, and consult a professional who has a comprehensive or a holistic approach so that the patient has a better quality of life. So in case you have any queries regarding the same topic, you can contact us or comment below. Thank you.